So welcome to everybody. So today we are going to start our main topic of learning. Learning this Douglas therapy. You all might be astonished, or you can say, why the anatomy and physiology is required for the spiritual healer. Why it is required? It is required to, you know, focus on that particular subject or object. If someone says that you should know, suppose some eyes are yellowish, or urine is going very yellow, you must be able to understand that there is some problem with the liver. And try to see most of the things that diet is very, very important. It is generally said like that. The food should be as a medicine. But nowadays, what is happening? Medicine is becoming the food. So food should be earlier time. Don't take the curds, or you can say buttermilk in the night. So there are so many restrictions as per Ayurveda, even for some critical, or you can say like whited lycoderma patches and all. I take the concept of the Ayurvedic guidance, no dietary guidance, for so that even if you stop doing wrong things, automatically the most of the things, it will be set right already. Okay, so like that, we should concentrate on the dietary things first, then what to do, what not to do. So definitely, uh, based on that, we will be able to give a lot many suggestions to everybody. Okay. Now, today we are starting the anatomy part. Means like, when the people, or you can say qualified doctors, start talking about the planes of the uh, body, that time you should not, we should not be unaware of it. Okay. So medial, lateral, transversial, like they call so many things, but we should know it what they mean. Okay, na? So we will see that. So okay, now we'll come to our oracles. Today our main topic is musculoskeletal and system. Bones, means we are not going into that very deep. I am sending you the anatomy and physiology notes which I purchased, and that also they have taken all the, what do you call, duty free, means not having any copyrights. You can read, print, and that is at your disposal. You can go through in the depth. When you want to go deep, you can discuss on that, because we are 5.5 year syllabus we are covering in 3 months. So we will be touching where and all we can repair easily. We'll only talk about that where we can touch it, so that we will know what we are doing it. So I will circumstances will come on today's uh, I know class. So we will take that, and will also take the what are the disease it is covering, and if disease it is covering, how we can do through our vibronics. What is the scope of vibronics in this particular issue? Okay, we'll do that.
Namah Shivaya, Sir Ji.
Namah Shivaya, madam. Namah Shivaya. Namah Shivaya.
Shivaya.
Thank you, Armit Madam Ji, Mata Ji, for joining.
My pleasure.
Yes, ma'am. Thank you.
Thank you, sir.
So, today, as I was told you, when doctors talk about their own means, the language of anatomy and physiology, we get confused what they're talking. But in terms, it will be a very minor, or you can say very common language. But until unless we don't understand it, we feel it is very difficult. Okay. Now, let us start with the anatomical terms. Anatomical terms generally, why it is required? Because when we read any of the reports, anterior, posterior, or medial, proximal, and superficial, when these words are used, you should know that yes, they are talking about this particular topic. Okay, for that reason. So now it is some are very common. So it doesn't need any explanation, but still anatomical position is the standard reference position to the describe location of the body and structure and the relationship between them in the anatomical position. Body is standing upright, facing forward, arms at the sides. Let us see, have I taken that? Yes. So like that, palm facing forward and standing looking at the front. This is the anatomical normal position from where we can start reading the body. Okay. So you see, superior toward the head or upper part of the body. We will see all this in the next slide. We will be able to see the from the you can say hip to upper portion. We call it a superior, or inferior, the for lower part of the body, and interior, inside of the body, and posterior, outside of the body, and medial means center of anything, center line that we will see. Okay. Proximal means near to the attachment of the, that with reference to the another thing that we will see here, it is there. And superficial means external part of the anything superficial. Okay. So now let us see the planes of the body region. So this I will give you because I'm going to give you the anatomy physiology book itself. These are already there. I have just copy and pasted these pictures from the same PDF, so that you will get more information about this. But for us to cover up the important things, that much is not required. Okay. So this part, when a body is divided into four sections, four division, one is superior, upar ka bhaga is portion is superior, the down portion is inferior, or and middle portion is okay, medial, and so like that you can say these are the different section of our body. If there someone is talking about the superior part of superior, portion of a body. So you can imagine then what they are talking about. Okay, right quadrant, left quadrant, right lower, left lower, simple. They are very simple. But when they talk, we feel, माने बड़े बड़े डॉक्टर जो बातें करते हैं, देन हम सोचते कि कुछ हुआ, क्या बोल रहे, एलियन लैंग्वेज में बात कर रहे, ऐसा नहीं. We must be able to correlate, listen to them, then okay, what they are talking, we can analyze how we can help through our drugless therapy, how we can help through the vibrionics, that all we can see. Okay, so the region of the body. Abdomen also can be divided into 9 regions that we'll see later. Right, that is right hypochondriac region, left hypochondriac region, right lumbar region, umbilical region, right lumbar region, right iliac and region, and hypogastric region, and left iliac region. That is not there in this. I will share you later, so that you can correlate what we are talking about. Okay, now it is the parts, how that our body is divided into different planes that we have studied. Okay. Okay. Now we see that let me see. Yes. Today's topic is that muscles and skeletons of the body. What is the main purpose of it? Before that, our organization means our body is made of what actually? Can anyone tell our body is made up of what? Electron, neutron, and proton. Basically, it is made up of electron, proton, neutron only. Then molecules. Then if you divide in, of course, Atma is different thing. Energy is a different thing. Chi is a different thing. But if you material wise, if you try to divide and see, the only chemicals you can see, atoms and molecules. Okay. From that atom and molecule, what is done? Cells. Cells are made up of okay. Cells are made up of this electron, proton, neutron, and definition. A chemical level is the smallest amount, I already told you. Next comes the cellular level. A cell is a basic building block of our body. Different types of cells are there. Bone cell, muscle cell, and so many different cell, skin cell, different, they have a different, as per the different purpose, different job, they are divided into a different type of cell. But basically, how that is taking different cell, then we will discuss. We will go into the, when we talk about the circulatory system, or you can say we go into the deep of that. And when, there is a immune system, that time also, all together we will be able to make a whole picture of our organism. मीन कैसे चल रहा है, क्या क्या खो के जा रहा है, उसमें हम पता चलेगा. So cellular level, in all basic structure of functional unit of living organism known as cell. Okay, cell are made up of various organelles and including the nucleus and cytoplasm cell, membrane. Mean what is the structure of cell? Cell का function क्या है? Cell carries out a specific function based on their type and contributing to the overall. I told you, cells, function of the cells based on what role we are giving to that particular cell. And this blank CD, like a blank CD, no? You can play with a blank CD, you can play the music also, you can play the movie also. So from where this blank CDs are coming? From our bone marrow. We will study, we will see when we see the bone structure, there we will study in detail. And if we see, suppose anemia balance or anemia, all blood, our organ medicine blood is there. In that one, why they have added different ingredient. With that, we will be able to assess what is responsible for making the good, healthy blood cells. Okay. Now, the next is, we saw what we saw? We saw the cell level. Cell, how that cell is formed. And what is the next level? Cell, the type of tissue. What is the tissue? Tissue primarily is tissue is a group of cells making one particular task. Meeting one particular task is called as tissue. Okay, where is it? This is organ level. The structure composed of example, system, organ, type of tissue. 4 types of tissue in the body. Okay, forms a lining of the surface of the cavity, connective tissue, muscle tissue, nervous tissue, and function. I think so. I missed a slide here. So I will tell you, when organ, there are the 3 level. One is organ level is there. Organ level only. When cell forms the tissue. Similar working cells form a tissue. And organ, different type of tissue achieving the same goal becomes the organ. It's very critical. Dhananjay, it is very critical. What? As different type of tissues forming, or you can say achieving a single goal, one goal is called as a organ. So even in the tissue, there are different type of tissues like connective tissue, muscle tissue, and nervous tissue. Function. Tissue provides the structural support and protection and enable the specific function in the body. Okay, so we will see some of our what I have. I'm going to give you soon after finishing this, and in the previous batch also I have given those things which I told you. These are the notes purchased by me. So these are all copyrights. This PDFs. You can use it. You can make a slide, and you can use it for any purpose, many purpose. Organs have a specialized function that contributes to overall body function and the system. So what is the definition of the organ? Organs are structure composed of 2 or more type of tissue that work together to form a specific function. No need to be a same tissue. They are more than 1, 2 or more type of tissue. They are doing the one particular work, one particular function that can be called as an organ. For example, heart, lungs, liver, kidney, brain, and stomach. Okay. And functions, organ have the specialized function that contribute to overall function of the system. ठीक आपको पता है ना different we have a all complete one complete system. One makes our heart pumping, another makes the detoxify our body, another makes the our endocrine system, means makes our body in a very balance. So like different functions are performed by an organ. Now next is system level. The system groups are the organ that work together to perform specific function and the maintain of the homeostasis. Yes, homeostasis is a very important thing. What is homeostasis? Homeo means same. Stasis means status. You know, when if you get hot, or can say hot weather, you sweat. Why? So that you make yourself, your body cool. Or you can say when you get a cold, you shiver. What is the shivering? Any moment, just rub like this, it produces the heat, right? The shivering produces the internal heat. So like that, this organs, they function to perform and do the maintain homeostasis. Like if you are getting the प्यास लग रहा है तो we take a water. We take water to balance the fluid level in our body. Even though you are thirsty, you don't take water, what happens? You faint, you collapse. So that's why organs they are work in such a fashion, they make you thirsty, make you hunger, create the hunger, or you can say it stimulate you to pass the natural calls, urine, stool, and all. So they make your body in the one equilibrium, one static position. Or when you run, suppose when you're running, what happens? Your heart pumps more faster. Why? Because more you work, the more the energy needed for the body to balance. So like that. So homeostasis also is very, very important. Means automatically our body is so beautifully, wonderfully programmed, AI programmed, it automatically balances itself. Okay, example. The example includes the circulatory system, respiratory system. Yes, you can see also when you are running, what happens? Your breathing also. Respiratory system also accelerates, you can say. More time you breathe in and breathe out because more the energy you require. So respiratory system and digestive system, everything is like that only. Respiratory system, digestive system, nervous system, musculoskeletal system, and endocrine system. These are the example of the system. The system integrate the function of the multiple organ to support bodily function, maintain homeostasis, and promote overall health. Okay. Okay. What is actually now next level? What I just told you that what is the purpose of our muscles and skeleton? What is the purpose of that? Function of the bone is to support, protect, and movement and blood cell formation, mineral storage. Have you ever anybody, I think so, if somebody is actively involved in the all medical terminology and medical system, they will understand. But very rarely people know that the bone produces the blood cells. Okay. Manufacturing unit is the blood cell formation is done in the bones. So the importance of the bone is like a support, protection, movement, and there are types of bones. What are the types of bone? Let us see. I can show you here. Yes, we saw this just one. Cell forms the tissue forms the organ forms the organ system and a human body. Okay. Now the skeletal system. Skeletal system, is it completely visible to you? This slide?
Yes, sir.
Yeah.
Yes, sir.
Yes, sir. Thank you. Support. The skeletal system provides the structural support to the body, maintaining its shape, providing the framework and attachment to the muscles and organs. Most important is our structure. Like, for building, most important are the columns. Like columns, like our bone system, that skeletal system is very important to, if we are able to sit like this, because our bone, I mean, skeletal system is working and muscles are working. Muscles are protecting us from the falling here and there. आप देख लो किसी को अगर पूरा he doesn't have any energy, then what happens? He generally falls here and there, left or right and front. That is, we can assume when अगर बोलता है ना कि पानी को एक बोलते हैं कि फिश को पानी का इंपॉर्टेंस पता नहीं रहता. Like us, we assume and we take for granted that oxygen is everywhere. When you go to Kedarnath, the lack of oxygen, there you understand what is the really usage of how beautiful in environment we are there. The lack of oxygen creates a lot of problem, like, slowness of this one, you tired, get that tired, like that. When we have this supportive system of the skeletal system, we don't value it. So these are all the, you should minutely, you should thank for everything, like a gratitude. People say that I have a wonderful eyes, I have a wonderful this one, and you have to say all this Reiki and Reiki masters or all spiritual healing system, they emphasize on thanking, to be grateful to the God, or you can say supernatural power. Protection. Bone, what next does? Protects delicate organ and tissues. Yes. Kaisa? Ribs. Ribs is a bone, no? That protects the lungs, or inside pancreas, here liver, and so many things. Bone protects the organs and even brain. Toughest bone. It protects our brain inside with the very strong skull bone. Okay. Next thing is movement. The skeletal along with the muscle joint allows movement and locomotion, that is movement. Bone serves as the attachment point for the muscle, enabling voluntary and involuntary muscles. When we come to the muscles, just next we will tell you what are the type of muscles. Okay. Blood cells production, bone marrow. the bone marrow within the certain bone produces the red blood cells, white blood cells, and platelet through a process called hemoptysis, hematopoiesis, you can say. Mineral storage also. Bone stores essential minerals such as calcium, phosphorus, and it can be released into the bloodstream when needed by the bodily function. Okay, so these are the main functions of the skeletal and bone. And type of bones. Long bone and short bone, flat bone, irregular bone, these are the thing. Structure of the bone, these are not that much importance to us. Still, it is in the slide. We can see. So these are the type of bones. Yes, I will show you. This is one long bone. What all the parts of the bone? And you know that we all know that one bone has a circulatory system. Bone has for the supplying the nutrition to the bone and all, we need a circulation. What are the parts of the bone? Spongy bone, red bone marrow, compact bone, and the covering of the bone is called as a periosteum, and nutrient artery, like that. And one more thing, now we are just telling, if suppose you're getting the injury, I tell everyone how you should think, how you should study about the how you should study the homeopathy, or you can say healing system. How you should study. Now I told you when I was a kid, when I was in 10th standard, I used to go to my auntie's maternal uncle, mama, and to learn about the homeopathy. Then what happened? I must tell now. We should remember. Now make a note of this, and sometime, somewhere, you will be definitely it will be useful to you. Okay. So yeah, above this bone, what all be there? Muscles are there, nerves will be there, and arteries and veins will be there, and muscles and the skin layer will be there above this particular bone. Okay. When I told my Guruji that, Guruji, what happened today? One fellow fell down and he injured his leg. Then I gave him arnica, but it did not work. Then he said, the arnica is a very patent or very excellent medicine for any injury in the homeopathy. But he said, my dear boy, he should not he should not think like that. Injury is equal to arnica. Always it is not true. You should think the injury has happened in the what level. If just everybody please note, it's a wonderful, this is my Guru mantra. Guru gave me this mantra, how you should study, go into the deep into the medicine to find out right remedy. He said, the injury is at what level? Is injury on is it affected his bone? It is deep inside. Is it affected the bone? Then you should give this infightum. If it is the periosteum, you see, there is a periosteum here. Periosteum If there is a periosteum, that time it is ruta. Ruta gravis is one of the remedy. Ruta G. Homeopathic remedy generally works excellent for periosteum, and generally it is given for all injuries, and is also a very good excellent remedy for eyes. Okay. Now, then you come, we just come outside, as you know, we saw the bone is a symphytum and periosteum is the ruta, and there will be a you can say muscles and the blood vessel. Below that there will be a nerve system. If any injuries to nerve, you must give the hypericum and leadum. If then come back to the blood vessels and muscle, if blood vessels and muscles are injured, give the arnica. And over that, there is a skin level. If skin is also injured, you must give the calendula externally. Then I thought, oh, it is not just injury equal to arnica, it has that money level. And he was a very, very excellent homeopathic practitioner. His name is there in Dharwad today also. Very beautifully. His son is running now. He's leading the clinic. So likewise, when I saw the bone, one should think in this particular, in this way. Okay. At what level? What level it is affected? Based on that, we have to select the remedy. Even when, how we have to do? When you have free time, how you should study the your uh, Narayani mixtures. Go to any Narayani mixture, go to the injury mixture, study one by one. Why he had added this symphytum, why they have added the ruta, why they have added the hypericum. Then go into the deeper level. See, when you are studying, I will give you in very detail how you should study the materia medica, how to come to the conclusion that how what remedy to be given. This is all our part of journey. We will take it. Don't worry. Next is muscles. On the bone, there are muscles. Okay. So there are types of muscles. What are the types of muscles? There are two types, three types of muscles. One is skeletal muscles, which are attached to skeleton, and these are attached to skeleton bone by tendons, and allowing involuntary, allow voluntary movements such as walking, running, and lifting object. Skeletal muscles, they are voluntarily muscles, means you can move with your with intent. We can, if you think, you can move that. But smooth muscles are walls of the internal organ and blood vessels and other the structure. They are responsible for involuntary movement such as peristalsis and the digestive tract. And those I think so uh, they're dealing with the non-vegetarian. They can really visualize what is the smooth muscles and the hard muscles. Okay. So the smooth vessels consist of all stomach and liver and all. They are not in our control. And peristaltic movement means small movement, in the intestine. When we study the digestive system, we will go into it. Okay. Okay. Then I will show you one video so that just to how we can see the anatomy and physiology actually. Anatomy and physiology of a skeletal system. And again, we will come back to this topic again. I've taken all the royalty-free videos.
Are
Not
you scared by this image? Be comforted by the fact that the skeleton not only provides rigidity and structure to our body, it's essential for the protection of vital organs like the lungs, the heart, and most importantly, the brain. So, the skeleton is a vast structure, and in order to make it easier to study, what we do is we break it down into two different parts. So over here, the part that you see in white, that part is called axial skeleton. Axial stands for axis, so this is the central axis of the body, and the axial skeleton is present very close to the axis, hence the name. Now, the brown part, the rest of the skeleton, all these parts, they are called appendicular skeleton. Why appendicular? Because our hands and legs, these are appendages.
attached.
So appendages are things that are attached to the main body, and these appendicular skeletons provide support to our appendages. Hence, they are called appendicular skeleton. So in this video, we will look at different parts of the axial skeleton and what bones make it up. So let's go to this part first, our skull. So these are two views of our skull, and the one in red, this part is made up of cranial bones. All these cranial bones, they cover the entire head, and they're also present inside the eye sockets. And what about the blue part? These bones, the blue bones, are called facial bones because, as you can see, they make up the face. Now, other than the cranial bones and the facial bones, the skull has a few more bones. 6 of them are present inside the ear. So this is our external ear, and if you go inside, here is the middle ear, and here are the ear ossicles. So we call them ear ossicles. Ossicles are nothing but small bones. So they are really small as you can see. So what are these bones called? You might have studied them in a lower grade. This bone right here is called the malleus. It's a hammer-shaped bone. And the next bone, this one right here, it's called the incus. It's an anvil-shaped bone. And the last one is a stirrup-shaped bone and is called the stapes. The last bone that we're going to talk about in the skull is a bit weird. So as you can see, it is present below the jaw and in front of the throat. So it's called the hyoid. And as you can see, it seems to be hanging in the air. So that's not done by any other bone. They are connected to some or the other bone, but this one is not. Then how does it stay in place? How does it not fall down? That's because even though it's not connected to any bone, it is connected to muscles. And it helps in the movement of the tongue, the movement of the throat, etc. So that's what we have in the skull: the cranial bones, the facial bones, the ear ossicles, and the hyoid. Now let's move over to the vertebral column. So the vertebral column, I'm sure you know, it's our backbone. It's present in the back, of course. And the vertebral column is made up of these small units called the vertebrae. And there are different kinds of vertebrae depending on the level at which they are found. So the vertebrae at the level of the neck, these are called the cervical.
I want to stop here and tell you, we have the excellent remedies for this. Like a OM4. OM4 is for cervical. So organ medicine 4 is for cervical. And those who, I think so, everyone is aware of the Narayani Mixtures Volume 3. In that one, you can see this region and then the neck region. Anybody is having discomfort and, they keep moving, people keep moving to get some relief. For this, OM uh, 4 is excellent. OM4, OM 18, and that is comes under the lumbar region, and like 31 and 32, they all cover the spine. And I have seen in my healing life, maximum relief, this has given without any fail. So you should also remember, if anybody is having pain at the cervical OM, and what all things, this first of all, this cervical region is a OM4, that is fine. What is all it made up of? It is made up of bone. If there might be any bone decay, or you can say bone enlargement, or you can say bone problem, you can add Bonite 200 also. So likewise, you can make it you have to just like, what all can cause the cervical pain here. So all those causes must be covered so that, the person gets well.
Vertebrae. Cervical in Latin means neck, hence the name. This portion, this entire portion, is the chest region, and these vertebrae are called thoracic vertebrae. Thorax means chest. So there are 7 cervical vertebrae, 12 thoracic vertebrae, and then in this region, the lower back, we have 5 vertebrae which are called the lumbar vertebrae. There are 5 in number, and lumbar relates to loin.
OM 18, OM 31, 32, they are excellent remedy for lumbar vertebrae.
So loin is the lower abdomen region. So that's what the lumbar vertebrae support. That's why they're called the lumbar vertebrae. And below the lumbar vertebrae, we have this white bone, and this is the sacrum. There is just one vertebra. It's the sacrum. In other animals and in our ancestors, they used to be separate vertebrae, but in us, all those separate vertebrae have fused, have joined to form one single vertebra, sacrum, which forms the base of our vertebral column. And the last vertebra is the coccyx, and you might have heard it is also the tailbone. It's also 1 in number. Again, like in other animals, there are coccygeal vertebrae. There are a few coccygeal vertebrae, separate ones, but in us, they have all been fused together to form one bone. And what does it do in us? It has absolutely no function. We do not have a tail, so in us, it's a vestigial organ. So this is all about the vertebrae. Now, the thoracic vertebrae, they are, as you can see in this picture, connected to the ribs. So we come to the ribs. So there are 12 ribs on each side, and each of the ribs are connected to the thoracic vertebrae at the back. So 12 thoracic vertebrae, 12 ribs. And at the front, they are connected to this bone, which is called the sternum. So depending on how they're connected to the sternum, the ribs have different names. Okay, so first let me label the sternum bone. This is the sternum. The first 7 ribs, they are directly connected to the sternum through cartilage, of course. So these white things, they are not the ribs themselves, they are cartilage. But all of these 7 ribs, they are connected separately to the sternum. All of these ribs, they are separate from each other, and they are connected to the sternum and are called true ribs. Why? We will see in a second. The next 3 ribs, this, and this, 8th, 9th, and 10th ribs, they are not directly connected to the sternum. Instead, if you notice, they are connected to this cartilage of the 7th rib. All of these ribs, 8th, 9th, and 10th, they are connected to their own cartilage, which join, and they in turn join to the cartilage of the 7th rib, which finally connects to the sternum. So these three ribs are not directly connected to the sternum but through the cartilage of the seventh rib. Hence, they are called false ribs. That doesn't mean the ribs don't carry out their function. They are ribs. It's just a nomenclature that we follow for our own understanding. And the last two ribs, as you can see, these two ribs, they do not have any cartilage of their own at all. So the 11th and 12th ribs, they don't have any cartilage. They are not connected to the sternum. So they are not connected to the sternum and are called floating ribs. They seem to float, hence are called floating ribs. So to summarize, we have seen that the axial skeleton is made up of the skull, which has the cranial bones, which covers the head, then the facial bones, which covers the face, then there are the ear ossicles in the middle ear and the hyoid below the jaw in front of the throat. And then there are the vertebrae in the vertebral column, neck region, cervical vertebrae, chest region, thoracic vertebrae, lower back region, lumbar vertebrae, base of the vertebral column, sacrum, and the tailbone, the coccyx. And then there is the sternum in the front, and then there are these 12 ribs. The first 7 ribs are the true ribs, the 8th, 9th, and 10th ribs are the false ribs, and the last 2 ribs are the floating ribs. And together, the sternum, the ribs, and the vertebrae, they form the rib cage, inside which are housed the lungs and the heart.
Okay, so now again coming back to, we have seen there are three types of uh, there are three types of muscle. One is skeletal muscle, smooth muscle, and cardiac muscle. Cardiac, they are special type of muscles. They don't stop. They keep working from our birth to the end. And there are some, I'll show you some of these, some joints. You have heard about the term called ACL? You know,
Yes, sir. Yes, sir.
ACL tear we hear. So where is that ACL? This is here. And ligament, actually, I will definitely take one more additional class. So I will tell you the frequencies of these parts. Okay. So frequency is bone, what is the frequency, and what is the ligament, what is the frequency, and like that. So that is interesting. I was about to mark that only, but now at present, it may confuse you. So I left it. Okay, but I will take if you want that one particular frequency that affects and that heals that particular area. Anyway, there's prevents a forward movement of the tibia. So ACL prevents the forward movement of the tibia. So prevents the backward movement of the tibia. Means what is the tibia? You know, that ball-like structure which is there in front of the knees, or you can say which protects us from the sliding. You see? So this is called as it will not move here and there. To it will bind to this tibia. Okay, so if sometimes what happens if they due to the sports or injury, if this the tear tears down, that time the tibia starts moving here and there. So for that reason, we have, we will study when we study the remedies, we'll go into a depth of this. And here also, we have to see the parts of this is smooth muscles. This is the muscles only form the cartilage. And for muscles, what are the remedies? Aristox, ruta, and symphytum. Symphytum is again bone, like bryonia. We will come to that a single remedy later. We'll study the group remedies. Okay, what are the now we will see what are the problems of the now first another important one because I added because our success rate in the treatment of the calcaneal spur is very very high. I told you there is no any only you just after qualifying your what you call uh, the drugless therapist as a just you say heal heel pain clinic. Okay, only heel pain or you can say heel pain healing center. Okay, the success rate of the healing this is very very high. We were able to give relief to 95% the success rate. Okay. So what is that? You see here a calcaneal heel bone. Where is a calcaneal heel bone? You get here they get a spur. What is a spur? Spur means the additional growth in that particular area. What will be the symptoms? Means the first step when they step from the bed, it will be very horrible. When they keep walking, that pain will be less sensitive. Sensible. They don't sense that much pain, but those still feel is they there. When something keep pricking at that area, that area becomes numb, and then they don't get pain. And as and when they stop somewhere and start walking, again the horrible pain will come. So that is calcanea, calcaneal spur. And what is the treatment for that? The most wonderful remedy in our the numerical, volume 3 is mixture number 3, bone eye. Bone eye, you see that in beautifully explained, either the decay or the enlargement. Why it is they have added that? They have added all required bone, whatever even they have added the Hecla lava and even potentized the bone itself. Like that, they have added that we don't know what is happening, but it gives wonderful results. And one more in numerical mathematica, we have uh, a rate for calcaneal spur and plantar fasciitis. It both looks similar. So what we do, we add both the things. In case of Parmanath Brahma, you have to reverse it because it is a disease. And like that, when we are making with our own, I am very successful in the even traditional way making it also. I just make it on a 10M potency. All disease to be made in 10M potency, making in 10M potency, giving. I am getting a result within 15 days. And for this, people suffer years together. That is the beauty of this. Okay. So next. As we studied about the heal, we will see what are the general uh, common injuries and condition. What are the common injuries and condition? Fractures, sprain. Yeah, fractures, we know that boni can be given and symphytum in a single remedy. And sprain and strain. Again, you can say the pain, Soham pain is a very good remedy. It covers even cramps and spasms also. It is there. So you can just see the Soham pain, what all the ingredient of Soham pain, and you can appreciate that, it will cure, have this particular problem be cured. And you see, plantar fasciitis, we just saw about it. Inflammation of the plantar fascia, a thick band of tissues running along the sole and the feet. This also it gives a similar effect of like a plantar fasciitis and the calcaneus spur. Both the symptoms are similar, almost similar, and at that same place only. So we mix together, we give both. I have given always plantar fasciitis and the calcaneus spur both, along with a boni and OM boni also, because it has to be, wherever it is a grown, it has to reduce back to the normal. So we are adding there also. Okay. So a bony bump that forms the base of the big toe. Base of the big toe here. So for that, even you can say sometime there may be a increase of a uric acid level. And what is the remedy in our uh, volume 3, mixture number 82, gout. When you give the gout, and along with that, you can say gout is also a sort of rheumatism. You can give the what you call RA 200 also, and that is a painful. So we can give the mixture number 59 pain and Soham pain, so that you cover the symptom also and you cover the cause also. And a similar way, there is a different you can say names, but you have to think what are the parts involved, what are the like muscles involved or nerve involved, or you can say based on that you can give the remedy. Tarsal tunnel syndrome. This also, it generally even in hand also it happens. So you can say causing pain and tingling in the foot. And tibial nerve, when you cut a word nerve, then we must think about hypericum and leadampal. We will see what are the problems, what are they can say diseases covering under the, in this one we will know. Okay. Now you see, we have studied the leg. We will study the hand also. What are the parts of
Sir,
the, yes?
sorry to interrupt you, sir.
Yes, ma'am, tell me.
Sir, actually, the spinal cord in the video you showed
Hmm.
different vertebrae regions.
Hmm.
So, in that, uh, if there is some bulge, like uh, bend, like it is seen clearly in the spinal cord region,
Hmm.
and like inflammation, the doctors are may say it is like inflammation, but when we are seeing normally, we see that like there is some small bend, like
Yeah, disc bulge.
posture
Hmm.
defect.
Hmm.
In that way, for that also we can give medicine here, sir. In this,
Yes, yes, yes.
we
Very,
can
we
treat.
can give. We can give. And I told you, we were
Uh,
very successful in treating the spinal cord.
Sir.
All are, yeah, please.
Yes, sir. Yes, sir.
Ah,
I'm just listening.
yes, yes, yes. Like
Mm.
OM 18, OM 31, 32, and OM 4. They are excellent remedies. Many people come from far distance,
Uh,
and
uh,
for taking these remedies. And at any stage, it has helped a 18-year girl also. It has helped around 50, 60 years so the adult also.
aged people.
Yes,
Uh,
beautifully it has helped. And first you have to see what is the behind it. What is the behind that? The spinal cord. Spinal cord
mm,
के अंदर क्या क्या रहता है? What all the
mm,
ingredient of the means sub parts of that? Nerves
mm,
are there. And
mm,
even if you want to go in the deeper level, you get
mm.
the vertebrae also. For different vertebrae also, you are able to treat it separately. And there is a in frequency therapy that is called
Uh,
as 40 and 10 hertz. If you are giving 40 hertz and 10 hertz, that we will be, I'm going to develop next level. So that time, if you give 10 and 40, you'll be able to relieve the pain also, back pain also. But ultimate, our goal will be
uh,
drug free, non-invasive, like that. So we will, if you have any particular case like that, we will discuss,
uh,
and very, very easily and within 10-15 days, they will get a relief. And there will be
sir.
pain also will be there in that. So we have to
Uh,
do mixture number 59 for pain and Soham pain. And Soham skeletal is a wonderful combination. You can see why wonderful. They have covered everything. They have even covered the calcium mixture also. They have added calcium mixture also along with
uh,
the bone.
okay, sir.
When I'm in hurry, I have to give someone the back pain mixture. I only give
Mm.
the Soham skeleton. It covers everything. Fantastic one.
Okay, sir.
Yes, madam.
Okay, sir. So it will be healing the middle upper part, means like shoulder blade and that
Yes.
part means in the they are
Shoulder,
saying
that part
thoracic
is
vertebrae.
OM4. And lower portion, lumbar portion is OM18, OM31, OM32, like that. 33 also. That is even it complete spinal cord it covers.
Uh-huh. So OM4 for upper part of the
Yes,
spine, sir.
OM4 is a cervical
Okay.
part.
Okay.
Then
Got it,
what you
sir.
have to do, you have to, if the lower part, you have to say, I just say everyone to do the Bhujangasana. When
Mm.
you are Bhujangasana means slightly, you have to press backward and when we are getting up from the
Yes, sir.
bed, just,
Cobra pose.
yes,
Mm. Mm-hmm.
cobra position, correct. So
Mm.
that automatically, it all that back problem comes because of what? Improper bending position,
Uh,
bending forward only bring lot of problem. When we bend backward in a cobra position, the bone sets back itself. With that, when
mm.
we take the remedy, and that will stimulate to go back to its original position.
Okay, sir. Okay, sir.
We have done very successfully in this treating these type of things.
Okay, sir. Thank you. Thank you very much, sir.
Okay, ma'am. Okay. We already spoken about this because this type of muscles, one that we already talked about, that attachment to bone for movement is voluntary. Skeletal muscles and smooth muscles, so they work on the intestine and other body parts. And the cardiac muscle is purely in the heart. They are in the heart only. Okay. What are the functions of the muscles? Skeletal movement, circulation of the blood, and mortality of GI tract content. Mortality of GI content means movement of whatever gastrointestinal tract what we eat when you should pass from the our esophagus to the anus through that. All this is done by the muscles. They push peristaltic movements and secretion of the gland and structural support. This structural support is also done by, and even the secretion of gland, it stores the energy. Okay. So now let us see what are the diseases, how we can treat, what are the skeletal and muscles diseases, how we can address that. Give me 1 minute so that I'm searching for a. There's a very, very important one. Last time we used it, every time we refer that only because that's very easy for referring. There is an selection for good health. There is I always share with everyone, every person here, so that selection for the good health and see if I can, if I have that in my mobile. Kindly give me a minute. Mhm. I'll be back in just 1 minute. So I'm using two, three laptops, so this is missing in this. you will come to know everything about the muscles and skeletal system. Pasted here. Yes. Thank you for bearing with me. Thank you for your patience. We'll see that screen. Yeah. This is the PDF I will be always referring, because this is one with that, I made a many, you can say, videos on this, how you can make a zero to hero. So all this with zero to hero. So here, where is that the skeletal and locomotor system? Skeletal and locomotor system. Everybody can see. I think so. You can see. This is our quick reference, and along with the anatomy, we will see what are the problem and how we can address with our vibronic remedy. Yes. I will share this PDF with you, and all our other people, they have this, and even those are using my other software and other thing, I give that. Okay. So skeletal and locomotor system. Today, what we saw, we can study in the depth, but there is no use. But only you should know bones are there. What is the function of the bone? What are the you can say what bone consists of? What are the uh, what the function of the bone? So what are the diseases of the bone? So based on that, we will be able to see. We will see here also. What are the diseases of the bone also we can study. So arthritis and rheumatism is a most common thing, most common problem in the joint and the muscular problem. So what are the remedies for that? NM24, SR means single remedy, 310, that is radium. When you want to go in the detail, like SR 311 is Restox, and see, when they are writing like a 200C in the bracket, you have to set this potential only. On the card, when you see on the card, they'll be writing on the different potency. They are writing the different potency, but when they are writing Restox 200C here, that means you have to use this potency only. And see, this system is so beautiful that you will understand that what all the other things you need for treating the arthritis and rheumatism. Other thing means the heart chakra. They are using the heart chakra. Heart chakra, they have found out because they doused with with the disease, and they have concluded that this chakra is very much useful for this particular problem. So Medorinum 1 m, one dose, repeat 2 weeks and see. Like SR 249 is a Medorinum. When we are going to study the miasmatic remedies in homeopathy. When we see the miasmatic remedy, king of psychotic is also called as a Tuja and the Medorinum. We'll talk about it, because my idea is we must become as per as with the homeopathic doctor, because we study both the same materia medica, same books, but the pharmacy is different. And very busy and very famous doctor, if on in my city, he is my practicing with my machine with a very great success, is very satisfied, and he is recommending the other person also to buy this machine. So you can understand that yes, vibronics is really better than any other therapy. Okay, I don't hesitate to say this, but it is a drugless therapy, and we are working under the some frame. That's it. We will discuss about it, because the SOP for making I have already there in my video, how SOP for making setting up the healing center, how we have to do, what all you should follow. Because see, no one cares you later. It is only an initial problem. Once you start working, people start coming, people start getting better. I'm telling you, you only put the heal cure center, or you can not, don't use the word cure, healing center. You do it like that. Or you can say healing the camp. So you will see that out of 100, you will be definitely able to give relief to more than 70% people. In all allopathy, that is the highest they consider. If 70%, if some remedy is giving 70% result, they consider it is a good for human consumption. And here we are not using anything else. And we are going to how we can make it drug free. We will discuss. Even we can put this vibration on the honey bottle also, but provided honey bottle should be round, because overall we are working with a geometrical shapes and geometrical pattern. As per the Malcolm Ray's instruction, it should be a round bottle. We can infuse any of the healing energy. Okay, next is arm pain. See, arm pain, if someone is using the digital vibronics, it will be very easy. You go to the same number at 258, you will find Califas there, and set the potency 200 and just click it. Within 4 seconds, it is going to imprint on water. The thought will be imprinted on water within 4 seconds. And within 4 seconds, how many times it is, giving you that reading? I mean, repeating that vibronic number 252 times. Okay, means 512, yeah, correct. 256 times. So that many times it is repeating, so we repeating that, that water becomes that, geometrical shapes goes to that water, and that becomes a remedy. So here it's very simple. Go to the NM 258, click, and NM 279, click. So for example, for your need, I think so I don't have another port here. Otherwise I would have shown you. I will make next time, make it possible. Okay. So that when you plug it, so fast you can do it. And hand rheumatism, any hand pain, arm pain is okay. Hand pain, what is the number? ST for hand rheumatism, there is a Narayani mixture number 58. And SR 311 Restox. What is a Restox? Restox, what is the symptom of Restox? Symptom of Restox is better by movement and better by movement and better by warmth also. Like, people, when I say that, someone comes to you with a, for a, remedy, they will ask like that, they do. सर मेरा हाथ में दर्द हो रहा है, like that, they keep moving and coming, हाथ में दर्द हो रहा है, like that. Means what, why they are doing like this, and what it indicates that the pain is relieved by the motion. So pain relieved by the motion, then you can say you have to, that is a restox. I tell you, I will also tell you how to go into the depth. I will share you the materia medica. Whatever the materia medica is coming here, we will go back and study. Go back and study. Or otherwise you can see, let me see here. Okay. Simple. We can go to the materia medica online. Yeah, materia medica. Materia medica, simple. You put a Restox. Restox. Okay. Restox, materia medica. When you say this Restox, materia medica, go and see. Don't see anything else here. Go to the, they are advising for what for it was advised. Yes, it is advised for hand rheumatism, Restox 30. You see, here where we can see that, here we can see in the extremities. Extremities means in the materia medica language, they are the legs and hands. Any information about the legs and hands, that will be available in the extremity. You see that hot, painful swelling of the joint, pain, tearing in the tendon, ligament, and fascia, and rheumatism pain, rheumatic pain spread over the large surface of the nape of the leg. Means you can see, can correlate. If any other problem is also arising, you can check it here. I just what I told you, better by motion. If they are coming, Dr. Saab, they call you Dr. Saab only. Whether you say healer or anything, they will call you Dr. Saab. In North, because I stayed in the North India for more than 20 years, they say like that only. So they come, they shake like this, and means the pain is relieved by movement. So it is written here. Better by motion. Soreness of the bones and limbs stiff and paralyzed. Cold, fresh air not tolerated. It makes them like that. You can correlate like what I was telling you. If you want to go into the depth of this remedy, how this is like a caulopilum. Caulopilum is, I know, because I was as I practiced the homeopathy since 1987. So I know caulopilum is for the small joints. Okay, small joint. So even hand means it comes like that only. You can see here small joint pain. Again, they have added the caulopilum. And the colchicum is a bigger joints. So you can understand and know in the depth, like a natrum phos. That is a more acidic things, acidity creates the joint pain. So you can say natrum phos is one of the natrum phosphoricum in one of the most wonderful remedy for reducing the acidity. Okay. So you can say want how many remedies are there? Small joint pain. If someone comes to you with a small joint pain, only 1, 2, 3, 4, 4 medicine you add either by card. These are the card numbers. SM34, Soham 34, and SR single remedy 262, single remedy 373, single remedy 380. If you mix together and give how to make the remedies, I think so everyone of you are one or other system you are having either the card system or the dial system. Based on that, you can do that remedy and give. And next is osteoarthritis. Osteoarthritis, even people come with you with a diagnosed things only. They will come you with this is the thing, I have been diagnosed with this. I have been taking this remedy. They are keep on increasing. No relief. Like that, many people have come to me. They said that for the lifetime they have to take that remedy. There are very dangerous remedies that, but there was no any other way with the doctors. They say you have to take this only. There is no any cure, or they don't say any cure. This is only cure. And nowadays, that is a what is disease modifying drugs. They say it is declared. Then that we happily we consume that, and nobody one ask them because they are licensed to do anything. Okay. Anyway, osteoarthritis. Yeah. There is the bryonia. I was about to tell you the bryonia. Osteoarthritis. What happens in this one? They hold the movement. They don't move. When they don't move, and if the moment if they get pain, that time bryonia is a remedy. And phytoleka is a very, very beautiful remedy for the muscular soreness. Okay, phytoleka. And the restox as it is there, colchicum is there. Ruta, I was talking about ruta. Periosteum, the bone covering of the bone is called periosteum. It works on the periosteum. That what our Guruji told. Okay, rheumatoid arthritis. Rheumatoid arthritis, knee menopause. We have studied, what are the hormones which are affecting the. I am sending you the very big physiology anatomy that notes. In that one, when you go through that, we will understand that why menopause causes the porosity, or if some ladies go under the hysterectomy, removal of uterus, that time again they that leads them to the porosity. Bone becomes no, they become porous. That is also there. So in such cases, we can help by using these remedies. Okay, knees, and these are osteoarthritis of the basically knees, and after menopause also we can use this, so that KBS and liver KBS, if any toxins are there, the calcium deposition is there, or you can say that we can use in the use here. Liver, that is also a detoxifying agent. So B. Morgan, and these are what is the B. Morgan? These are all the batch nosode. This is called as a batch nosode. Definitely we will take some, when I was talking, we're telling about the batch flower remedy, we will definitely take this particular batch nosodes. Okay. So see the case history details. You can see the case history. I'll tell you, how you suppose some patient has come. You don't know. There is nothing is there in this. How can you search it? How can you search it? I will tell you very easily. Go to the vibronic.org, because I have spoken to the head of this Satya Sai. They don't have any problem, or I can say they don't have any objection if we refer their newsletter and case histories. Only don't refer them, because with that I did like that, don't do. See, there are so many case histories, and with for example, we will study what are the today's topic. We will take about the today's topic only. Where is this musculoskeletal? Yeah, skeletal system. This you can refer this also. Keyword search. Keyword search is okay. Knee injury. In case of knee injury, what you give? What we can give? Go to the. So they have given the CC combos. Those who have my digital Vibronic, they can create the CC combos within 5 to 10 minutes. And if some people, in case if CC combos are not there, in some places they have explained what the other Narayani mixtures and the other mixture have, what other thing can be taken. Cervical, I was talking about cervical spondylitis and the knee pain. You see, yes, circulation, emergency. Anyway, first thing is we can refer this. First thing we refer this because they are very easy. We are less in number because we know the ingredient what we are using. If you have a card machine, we can do it within 10 to 15 minutes. And if you have a digital Vibronic, you can just do it within 5 minutes. So like that, rheumatoid arthritis, ankle sprain easily. I was telling about lead and pal. Do you remember? Lead and pal is also a wonderful system on the wonderful remedy for nerves. And lead and pal specialty is pain travel from bottom to top. And arm pain, shoulder to finger. And see, beautifully is given only 2 remedies. Elbow pain, bone eye and Soham pain injury and skeletal and elbow joint. SR 488. You see, because we forget that we don't remember that there is a remedy called the elbow joint, because we are only concentrating on NM remedies. So you can use that also. Drop things, nervous system like a paralysis, we can see it later. When we are studying the nervous system, we will study that. Heel pain, better movement, with a better movement. So this is a remedy. Knees in general. Pain behind the knees. So there are only, you see, sciatica nerve. Yes, there is a sciatica nerve goes from the hip to the back of the leg and to till up to the feet. That time, this can be given. Water on the knees. Yeah, water on the knees means that is a excess of synovial fluid is there, water accumulation is there, that time people will tell you, they will come with that ನೀರ್ ಹಾಕೋ ನೀರ್ ಬಿದ್ದು ಬಿಟ್ಟಿದೆ ಅಂತ ಹೇಳಿದಾರೆ ನೋಡ್ರಿ ಅಂತ, ನೀರ್ ಜಾಸ್ತಿ ಬಂದಿದೆ ಅಂತ ಹೇಳ್ತಾರೆ, ಪಾನಿ ಜ್ಯಾದಾ ಆ ಗಯಾ करके बोल रहे हैं देखो कर. So based on that we can give the water in the knees, a leg pain persistent, keep leg pain keep coming, then this is the remedy. Sole and palm burning, beautiful, beautiful, everything is there. I will tell you, if something is not covered in this, what to do? That time you have to become a homeopath. These are all vibronics practitioners thing. Then I will tell you how you should become homeopath and how you can find the single remedy with the symptom. That we are going to study the repertory, how to follow the repertory. And so I am just at the end of this. Today again I will be sharing one of the select our remedy PDF, which is very, very important. Why that is very important? Select. Let me check if it is available. Yes. I will share now itself and I will tell what are the advantage of that. Okay. So next. Ganglion and yes, ganglion is what? Again, just like the big toe, you get a swelling and redness. That is uric acid level excess in your body. For that, what you have to do? Benzoic acid, ruta, and the SR253, and also the NM82. I think gout is a different thing. Ganglion is a different thing. Let me check up what is a ganglion, how it looks. Now, Google Brahma, Google Vishnu, Google Devo Maheshwara. Anna? Google Sakshat.
Yeah. Ganglion usually happens in the wrist, sir. Usually on the hand it happens, because I had ganglion on the
ganglion. Yeah.
It's a fluid formation.
Yeah. Okay. Ganglion. Okay. And for a ganglion, this is extra. It is for like this. This comes. And what is the electrohomeopathic remedy? Electrohomeopathic remedy is C5. Ganglion main remedy is calcarea floor. It is just like a fiber-like thing. I remember now, Dhananjayji was it what you told. Fiber-like things, it will move a little bit. And this is the remedy for that. And swollen wrist. For swollen wrist, yes, this is a remedy. Fracture in general. As I was telling you, what a fracture, if it fracture in general, what all you should cover? Bone eye, injury, pain, arnica, ruta, as I told you, one combination, or the second one, bone eye, infection, injury, soham pain, symphytum from the homeo store. See, they have written here symphytum from the homeo store because symphytum is not there in their card list, but I am providing everything. They are only, means the Satyasai people, they are using only 576 cards. Somewhere in this remedies, they write from homeo store. You don't need to go homeo store. We can make everything. We have to make everything from our own card only. Then only we can say it is a drugless therapy. Drugless therapy, thought infused therapy, or you can say anything you can call. Okay, very soon I am going to, after this, I am going to share these remedies and useful combinations. This is done by the Satyasai people only. Satyasai people, they did it before the CC combos. This was the guide given to the people before the CC combos. Later, I don't know, they have made a DCC combo. Okay, fractures. supportive tissue, connective tissue, and injury. See, beautifully you have to read this so that you will not leave anything, stone unturned for to tackle that particular problem. See, they have given supportive tissue and connective tissue also. In the injury, you see support in the OM 2730, their ligament, cartilage, they are all there. Do you want to address the ligament cartilage thing? You have to use the OM 27 and OM 30. And Soham pain as it is, and 33, and Soham sleep as it is. No, one won't get the sleep. If they are fractured, they'll be in the pain, so they won't get that. So for that reason, they have to use the sleep also. Fractures. Gout in general. Gout in general is the KBS 21 and liver 22, gout 82. Gout, as I was telling, benzoic acid, because why I was telling ganglions also, the excess of uric acid, because of this only. You can see gout also they are prescribing the benzoic acid, and benzoic acid is one of the most wonderful remedy for the gout. Okay. So bone eye injury, backup, calcium, gout, and sciatic remedy. Hip sciatica, and this is the wonderful thing. Sciatica is generally caused by the slip disc, or you can say disc bulge, or anything the near the sacral and lumbar area. So for that reason, they are using hip general 97. Generally, if you want to heal any hip area, so NM 97 and the OM 18 you can use. Along with that, I suggest you can use any Soham pain also you can add. You can add many things here. You should make sure that whenever you are adding the combination, you should head it towards the one particular, object. As we just studied that similar working cell become a tissue, and different working tissues making the similar goal become the organ, like that. Or a cell becomes the tissue becomes the organ. Okay. Similar working cells become a tissue, and different working tissues become having only one goal becomes the organ, like that. So in this way, we can say that when we treat the sciatica, we have to take care about the lower sacral and lumbar also. Jawbone decay and mastoid inflammation, muscles, cramp everywhere, anywhere in the body. So pulled or strain sensation, muscular dystrophy. Muscular dystrophy is one of the incurable disease as per the allopathic system, and that is a progressive disease. So you should know what it is. Before tackling that, don't give any false promise to them. They say that yes, so many people have become all right. He has become all right. You can also become all right. Like that, we have to only say that we can try. Never give a over assurance to anyone, because something is like that. They are uh, they are genetic, not only genetic, they are karma origin disease. So we have in our book, we have got a karma origin disease that also can be given, or our Mataji has made a smoke. With that, it is removing the karmas. You can try that also. Our Harmeet madam has made the medicine for the smoke, yajna smoke, which she believes that she no, removes all bad karmas of the past. And people are getting better. You can definitely try that. Posture out of alignment. NM20 injury for all sort of stiffness, pain, okay na, muscular dystrophy, osteoporosis in general, sciatica again. There are there is a sciatica and only that combination was there, but here and sole of the foot. They have also plantar fasciitis inflammation. They are also given that, and now as I told you, we are very great success in curing the plantar fasciitis or cutaneous spur. Back pain in general, you can say back pain, calcarea carb, spinal integrity. Spinal integrity this is called as a TC spinal integrity. You know that David Tansley had made only few 11 or 12, 13 combination or 15, I think so. 15 combinations. With that, he is covering everything. Means whole complete healing system can be done with that 15 cards, 15 numbers. That is in our book, with the spiral binding book, that starts with a TC. David Tansley, TC combination. Cocax inflamed. Coccix is generally the end part of the our tailbone also we can call. It is generally it get injured when we go in the hump and all. That really a horrible pain. That is, for that this is a combination. And lumbar sacral muscular nerve involvement is there anywhere. I told you already that in my example, you can give hypericum if a nerve injury is there anywhere. And small of the back. Small of the back means when it is almost the back pain sometimes comes because of a kidney problem also. So that is a Berberis vulgaris is one of the very good remedy for kidney and bladder. And scoliosis. Scoliosis is what we saw that that the scoliosis is the curvature of the spine. They come to you with this problem, with a MRI, X-ray and all. So if this is the thing, if this is scoliosis, that time you have to use this particular remedy. You see, bone eye, calcarea phos, spinal integrity, and bone eye supporting tissue. This is all the thing. Anyway, this will definitely give good result, and you should have don't over promise anyone. Definitely it is going to help. We'll see. We have to see. Okay, let us see. It is really because they come with a lot of hope with us. Then we can thighs pain while walking, thuja, medorinum, and one word tendinitis, cramp, injury, supported tissue, and lead pal and cocculus. Okay. This is definitely what we now conclude. This is a very, it is not a musculoskeletal part is very big. So because we come across, these are the major problem in with us, we can attend. And so we limit to our studies to this only. If you someone want to go deep, I'm sharing that the physiology anatomy part. They can go dive, think it, go deeper level. Nobody stops you. As I told you, we have a liberty to go deep and know at par with the homeopathic doctors what they study. We can bring our level so that we can also able to tackle those problem with the very easily without any side effect. Okay, so I think so. We finished around 2 hours. We'll conclude here. Any doubt and any suggestion, please? Any suggestion, any doubt?
Sir, I have a question.
Yes, ma'am.
For arthritis, you said the heart chakra,
Mhm.
but arthritis, there is burning sensation in the bones. So,
Correct.
So isn't that the navel chakra also involved? Can
Correct.
that be?
For that reason only, I was little hesitating to say because, but this is the Satyasai people made this chart, and
Okay.
those people, really taken very much pain. Definitely, we can add. I already told you, we can add many other remedies to this list.
Okay, sir.
So we can add to this list, but definitely it is a very suggestive thing. Like a small joint pain, we can add, and like in rheumatoid arthritis, they have added the vagus nerves also. And here we see they have done
This
here, they
whole,
are almost correct.
right, sir. Solar
Rheumatic
plexus.
and arthritis and solar plexus they have added, and heart chakra also they have added. Solar plexus is really a useful thing, useful chakra for treating the rheumatism.
Right, so because it
Lack
handles
of
the heat part.
Yeah.
Right.
No, that just solar plexus covers the heat mechanism, and lack of heat creates the stagnation. And because of that, this is the, yes, we can, your point is really true. I also stuck there because since they have added, I can't cut the remedy here because I have a great respect towards them, and
Right, sir.
uh, as per them, it might be correct. And you can add from our side also. No
Right,
problem.
sir. Depending on the symptom of the patient.
Depending on the symptom of the patient. They might have thought that the emotional problem creates the rheumatism, maybe.
Right.
So in that way, they have added the heart chakra. Heart chakra governs our all emotions.
Right, sir.
Yes.
Okay. Thank you, sir.
Okay. Yes, sir. The Dhananjay ji and the Kumar Swami sir, any suggestion so that you want the any improvement in this one? What else you want so that I can improve my you can say my notes, or you can say the way I want to tell you. Is it okay? Because I take the anatomy and what it is doing and what it is not doing, and if it is not doing, what are the remedy we have with us?
Sir, I'm happy with the flow that's going on, sir. So it is, I'm happy with it. I just had one question. I have this cracking guy, and my knee always cracks. As in, whenever I walk, I get a cracking sound. It's like
Yes.
how we break our knuckles, right? So I get that. So what is the remedy that I can use for it?
Actually, that is we have to, I told you, when we if something is not there in detail in this, we have to refer our materia medica. Materia medica, and that is and our repertory. Actually, remedy is causticum.
Causticum, okay.
Clicking sound, or you can say knocking sound in the knees, like that symptom is there. For that, many remedies are there, but I was many times successful with the causticum.
Okay, sir. Okay.
So we will study that. Next time I will take that also.
Okay.
I will take along with the remedies and useful combination. I will keep that repertory. I shared with everyone the Patak repertory. If that Patak repertory, I think so, not there in this laptop. Next, tomorrow we'll start with that only. We'll take that repertory, and how we'll take our case, and we'll see how we can find out the symptoms to the remedy.
Okay.
Knocking is not a disease. It is a symptom.
The symptom is.
So with this symptom, disease can be anything. The symptom will go off.
Okay.
So it may come in within like a dryness of the synovial fluid, or arthritis, or so many things. Osteoporosis, so many we will not name it unnecessarily. But if that is only truth, is that you are getting a clicking sound when you are walking sometime, So that we will find out in that repertory. And see, we have to talk in the repertory language only. Some they are clicking, they may say, knocking, they may say. We have to find out what they are telling. what is there in the repertory. You have to see, and we find out. And tomorrow I will keep that uh, book also side by side, so that
Okay.
if anything is not covered in this, how to, because that is I'm going to share that also in the group now.
Okay.
You can see in the knees, go to the
Yes.
knees topic.
Mhm.
And there, below the knees, you will get many options,
Issues. Okay.
issues.
Mm.
And
Sure,
in
sir.
front of that, there will be remedies, homeopathic remedies. So those things, if there is no problem in one or two you are mixing, there is no problem only. Once I
Okay.
did like that only. If someone, that is a thrombosis, severe blockage of the blood flow in the leg. He was
Mhm.
shouting like anything. He was crying like anything. So what I did, I just used that repertory only. That
Okay.
thrombosis, there were 5 or 6 remedies used there. So
Mhm.
all are almost a snake poison only.
Mhm.
One snake poison only. But all I created with the our remedy,
Mhm.
and he relieved within no time.
Okay.
Another Dhananjay, I was just telling about the snake poison. At the same time, there's one good news for us, for all Vibronic practitioner, that one day all homeopath will come to you for asking that remedy.
Mhm.
Lacasis, Bothras, and Naja, and so many remedies. Food and Drug Administration, they are trying to ban,
Mhm.
because they are made from the poisonous substance, or you can say so many in homeopathy they are producing by so many what you call virus and bacteria.
Mhm.
Tubercular bacteria, they are producing the tuberculinum. They are banning list of remedies, no, so that the to be for the safety of the uh, you can say the public, they are banning so many remedies. If they ban, totally homeopathy will collapse, or they have to depend on Vibronic people,
Mhm.
because with we all those snake poisons are there with us in our materia medica. We can produce by thought,
Mhm.
or you can say produce by the geometrical shapes, but they don't have any option. So we can say that, they are fighting, but in FDA, this already proposal has gone. Gone.
Mhm.
They are going to, I don't know when it is happening, because mainly homeopathy depends on the toxicology. Law of similars, what they say, what created the problem, same cures the problem, is the homeopathic principle. I was planning to start with the homeopathic principle, homeopathic this thing also. Let me see if I can take that tomorrow. We'll take that homeopathy, the principle of homeopathy, and mainly how homeopathy, because why we are, the day one I told you why radionic people started taking the homeopathy along with them, because it produced the ERA,
Mhm.
electronic reaction of Abraham. When they placed the homeopathic remedies, they started getting the reaction at the different places of the abdomen. So
Right.
that's why we Vibronic people and radionic, and some people, why homeopathy is coming in between, or you can say it is we are what we included those, because of that energetic
Energy.
patterns, or you can say energetic system of the those therapies.
Sure,
Tomorrow
sir.
we'll take yes, I was planning. Tomorrow we'll take the homeopathic principle, and what is the repertory, what is the materia medica, because that will be used in every this one. Whatever we topic we take, that has to be there in for our reference.
Sure, sir.
Okay. Yes,
Could you please share the repertory on the group, sir? Because I don't
yes,
have.
definitely, I'll share.
So one more question is out of this skeletal and muscle thing. Someone who has floaters in eyes, floaters in the eye.
Huh.
It is off topic, but I just want to know what eye remedy can we give?
What is the problem in eye?
Floater. They get the
Floaters are there. Floater.
floaters. Yes.
Yeah. We will see. That tomorrow we will cover that.
Sure,
Because
sir.
floater in eye is a symptom. So we will see in the floater in eyes floater, and definitely we will get a remedy, and with that they'll be able to tackle it.
Sure, sir. Thank
Then another thing I just wanted to share with you, and I think so I have already taken it here. Anyway, I will start. I will tell that also tomorrow only. There is one more book called Select Your Remedy. My old people, I shared to them. The beauty of that book is that is they have given the remedies based on the probability, not according to the alphabetical order. All the homeopathic the therapeutics are written on the alphabetical order. That is not correct actually. You should they write it on the probability of a cure. No, like a migraine. If they are writing migraine, which remedy cure the maximum migraine, they should tell. They should come on the first. In the like selective remedy, they have done like that. So like that, that is my first book, which I purchased in 1987 in Agra, because always we used to, when we go there, you follow this. This is a wonderful book, and that is a beautiful book. Tomorrow I may have to talk about that book at least for half an hour. That's fantastic. I will share that you very, very fast. That's a wonderful thing. That is one more step in the homeopathy. Or you can say vibronics, advanced level of vibronic, that is one of the step. Where these combinations are unable to give any result, you will be able to give result in by the selective remedy and the reparate. Yes, sir.
Sure, sir. Thank you. Thank you, sir.
Yes, sir.
Sir, hi. Yes, sir. Sorry, sir. My query is, sir. See now, the discussion on different things. Like just a second, sir.
Different topic, different diseases.
On Soham mixture, and then organic mixture, NM, SR, common combos. Sir, all these on the system, the digital ones, sir. So typically how to use them and how to convert them to our Paramanada Brahma ascending.
Digital has added advantages because it makes every remedy in 4 seconds. But that same thing you can do it by dials. Dial will take 1.5 minutes.
Okay. Sir, no, sir. My question was, sir. So as we go on, so all that will be discussed now, sir. Like converting. The codes to Nada Brahma, and then ascending, descending, balanced. So
no, those are not part of the training. But if you want, I can tell you, no problem. But those are the part of Paramnath Brahma. These are already there, sir, on the website. I mean, YouTube channel. Those are already there. If you want really how to convert those things, all people are, that Dipanjan has made a small tool for that. You give the radionic code, it gives the Nada Brahma code.
No, that is okay, sir. I'm saying in general, maybe towards the end, if you add a few other queries with respect to that, so that can be asked here, sir, in this here, sir. So is it okay, sir? Or is it only
no problem. You can ask anything, sir. You can ask anything. Now, so at the end also, what doubt you have, you can ask now. It's all now also, no problem.
No, I think let the flow go on, sir. I'm making a note of it, sir. So
Sure,
I have some questions
okay,
and all.
okay.
So the flow is good, sir. Fantastic, sir. A lot of information I've got from the last session and this session. Really enjoying the knowledge, sir. Thank you so much for your inputs and deep knowledge.
Okay, I'm sharing my all notes. They are very deep. Those are all, if you want to study, why bone, what are the purpose of the bone, what is a red, you see in our OM blood. OM blood clearly mentioned there is a white marrow and pink marrow. they have written there, red marrow, sorry, red marrow. So you can, they have their own purpose actually.
Okay.
So when you go in the deep, really it helps. But ultimately, what is required for the spiritual healer, that is itself I'm telling. If you want to go into more depth, you are most welcome, sir. Other than okay, usme, when you go deep, you will understand more better. Sir.
Thank you, sir. Thank
Yes,
you.
sir. Yes. Okay. And we will be referring this document, because this document also I will be sharing right now, so that what you can keep it as the reference. This is a most wonderful document. This was the document prepared by them before the CC combo. Okay, thank you so much for the day. Because there was a lot of let me stop this and recording stop.